Hello, everyone, and welcome to Team TSI's training today. First and foremost, we want to thank you all for your time and interest and attention today. As things are changing and as you are aware, I'm so privileged to be a part of a team that is working really hard in the backgrounds to provide resources and trainings for you. And today is a beautiful example of that. So our focus today is the CMS blanket waivers mapped to survey tags, and you'll see really a lot of discussion and probably some of the same questions that are going through your head are going to be discussed today. So we're really excited to have you and your attention. Before we get started, I want to go ahead and just make sure that you are comfortable with the GoToWebinar panel. We have questions that we want to answer throughout the training and handouts available on this panel. So if you could just take a second, find your GoToWebinar panel. Many of you may not be seeing it at all, so you may want to look for the little blue flower at the bottom of your screen. When you click on the blue flower, two things could happen. Either the first picture where it's a collapsed version of the GoToWebinar panel, and you would simply click on the orange arrow. It will open up and look like this second screenshot. If you click on the blue flower and you see this screenshot, simply click on the questions line. There's an arrow pointing to questions. And when you do that, a panel that looks like this will pop up. So this is where you're going to type your questions in for us. When you hit send, there'll be a number of us monitoring your questions, and we may be saving those towards the end. But if not, and we're able to answer them, you'll see the answers appear right here in your questions pane. The other thing we want to make sure is that you can retrieve your handouts. We have two handouts today. One are the slides for you so that you have all of the information that's being covered. And we also have a resource that's been created for you based on today's training. So with that, I want to thank you again for your time, and I'm honored to be a part of this team. You'll see that we have a number of our experts, actually all of our experts that have been working on this subject are on the line today, and I think you're really in for a treat if you haven't met them. So we have Hugh Heaton. He is one of our consultants, and I really would like to just thank him for everything that he's done for the 10 years I've been here. It's just a number of items that you're not even aware of that he's providing resources and in the background and his expertise with us. So I'm so grateful to have him on. And you'll have Greg Seipel, Pat Newberry, Jill Pugh. Those are our Team TSI experts that many of you have probably had a phone call with or met at a trade show or had the privilege of working with them one-on-one on a special project. And I'm so, again, fortunate to have each and every one of them. You'll hear a little bit from each of them today. In the background is going to be myself, Dahlia Croth, and Kelsey Little. We're going to be, you'll see our names when we're helping you with things behind the scenes. And as always, we do believe that this potentially could go a little over today, or you may have additional questions after today's training. So I want to make sure that you have the support team information. They're your first line of questions, issues. If you need expertise from any of our experts, they would be the ones that you would want to reach out to. And that's support@teamtsi.com or 1-800-765-8998. And with that, I want to turn this over to Greg.
Thank you so much, Dahlia, and thank you to everybody who's joined us on the call here today. I do want to give a very, very appreciative and special nod to Hugh Heaton, who I'd like to say has done the heavy lifting on this, but really he's done pretty much all the lifting on this. He has taken the time through the weekend to ensure that he's mapped the waivers to the federal tags that are associated with it. And again, in the goal of the session, what we're trying to accomplish, of course, is provide an overview of the CMS emergency blanket waivers. Looking at the information that's being put out, as you read through these waivers, you'll see the CFR, Code of Federal Regulations of 483.17, but there's a number of tags that may be impacted by that particular section of the code. Hugh has taken the time to walk his way through each of the individual tags compared to the waiver to determine which tags are actually being impacted. So where are the focus areas that are falling under each of these blanket waivers? And it's somewhat misleading to term blanket waivers. There's a perception in some circles where a blanket waiver means it blankets the entire section of the federal regulation and all of that's waived, but it's very specific in its scope. The blanket waiver simply means that no individual facility needs to apply for this waiver or this consideration. It applies universally across the country to all facilities. But it is very specific in its scope to the COVID-19 and the public health emergency that's going on right now with the pandemic. So what Hugh's been able to do is focus in on the areas to look at each of the individual waivers. What are the identified survey tags associated with each waiver? If there is a waiver that is not linked to a federal tag in the CFR or in the State Operations Manual, we did not include that here. We simply were trying to map the waivers associated with federal tags. We're going to try to look at the regulatory process that's affected by the waiver, and most specifically, what is not affected by the waiver. So there's certain things that are waived, again, directly related to the scope of the pandemic. And then, of course, there's going to be things that you're still responsible for because it does not just do this blanket type of waiver over everything. As we've been working our way through this, we're all basically in a low-level sweat from trying to keep up with it. It's not sometimes even merely a change from day to day, but sometimes hour to hour. And there's been updates that have come out as early as this morning. So it's really like herding cats to try to pull all this information together and make sense of it. When in doubt, what we're trying to do is raise awareness. Are you aware of which federal tags are linked to the waiver? Are you aware of what the waiver is covering? And are you aware that there may be additional responsibilities within the tag that are not waived? And simply sort of providing a roadmap to that information. I cannot tell you that we're going to have all the answers for you. This is going to be a little bit more of an open forum presentation where we're going to roundtable it. We're going to go through each of the slides. Jill has feedback to provide. Pat has feedback. Hugh most certainly has feedback to provide. And if you have experienced anything with any of these waivers that you've sought clarification out from CMS or you've seen information coming across, we encourage you to share that in the questions or the comments. Anything we can do to learn from each other as we work our way through this. And I think you'll clearly see that it's not crystal clear. There's still a lot of uncertainty in the waivers as to how something should or should not be applied. There's always that difference between the spirit of the waiver versus the letter of the waiver. And it may have intended to do this, but if it wasn't spelled out, where are the risks associated with that? And as we all know, every surveyor has their own proclivities when they come in to review a facility. If you're ever in doubt as to anything that we say or we mention or we discuss on here, I think me and the rest of the team strongly encourage you to seek guidance from your state agency. At the end of the day, before you take action on something, if you're uncertain, definitely reach out to your field office or your state agency for clarification, because ultimately that's who's going to be coming in and conducting your survey. So having said that, one of the first waivers that was put out was related to staffing data submission. And this was specifically related to providing relief for the requirements of submitting the PBJ data. When you look at that particular waiver, it applies to FTAG 851. That's where the PBJ reporting requirements are housed. And additionally, it does not eliminate the reporting. When you look at the waiver itself, it eliminates the time requirement. Or it waives, I should say, the time requirement to have the information in by May 15th, but the reporting itself is not specifically addressed. Again, only the time frame for the data submission. And again, it's used to report average numbers of nursing staff and total staff on site each day. So the information is still going to be utilized, though it may not be utilized from the PBJ standpoint for 5-star. CMS, CDC, OSHA, all will ask for employee information related to this. And we've had some discussions even this morning around this as well, haven't we, Hugh, in regards to the requirements?
We have. So
there
one
was?
of the things we've had a lot of discussions on that. This is Hugh Heaton. One of the things that we looked at is when you compare this particular staffing data waiver to QSO letter 20-28, And that particular letter provides information that specifies that it's only waiving the time frame. But when you look at the waiver itself, it doesn't mention time frame. And what CMS is looking at for this particular data is, while they may not be using, and you don't have to submit it, and they're not going to use it for your MDS quality measures, and they're not going to use it for staffing for 5-star, but they are going to look at the information from what your average number of nursing staff and total staff are each day. When you go back and look at transmittal number or QSO 2028, there is an Excel file spreadsheet that has a listing of every facility and what their average daily staffing is. And CMS says we're going to use that information to determine what the protective equipment needs are and where staffing shortages may be. They don't report that information, but they are going to use that information. So another thing is that OSHA is going to be looking at the same information. And I think Jill has some comment on that one as well.
Regarding OSHA, no, that would be Pat actually.
No.
But just to clarify,
PBJ.
on the PBJ, okay. Regarding the PBJ, I actually received clarification on the submission requirements, and they were simply saying that the deadline to submit the January 1st to March 31st, 2020 is allowed to be delayed. They will be submitting further information as soon as possible as to when that will be required. But as of right now, there are no penalties or negative impacts to staffing ratings for not submitting by that May 15th, but they are encouraging you to.
Yes.
They're still saying that.
Yes.
And one of the ironies in this, when you kind of struggle with the clarifications coming out of CMS, is there was a notice published on one of the public sites from the Chicago field office saying the data would not need to be reported at a later date. Now, is that an individual interpretation? Is that inside information that hasn't been released through Washington? Literally, as we've been on this presentation, Jill just got a response back from CMS stating that you may still have to submit the information. So the uncertainty and the unclarity is one of the maddening things that surrounds this entire process. But everyone's moving at a breakneck speed and pace to get the information out, and the uncertainty as to what it actually means is where we keep butting up against the wall. Hugh, you had something else to add?
I do not.
Oh, I'm so sorry. Pat, did you have anything to add?
No, thank you. I actually was going to just underscore what Jill was saying, is that CMS is just simply saying we're not going to attach penalties to submitting your PBJ staffing after May 15th. But it's pretty clear with what we're seeing is that at some point you will have to submit this data. So I really encourage you not to forget to collect the data and get it ready and go ahead and submit it, really.
One of the next waivers related to MDS assessments in the transmission. So the waiver specifically pointed out to CFR 483.2 to provide relief on the timeframe requirements for MDS assessments and the transmission. The tags that specifically applies to are F636, F637, F638, and F640. Now, of course, blanket waivers, again, the impression that it may waive the entire portion. It does not waive the completion of the MDS requirement. It only waives the time frame for the MDS in which it can be completed. Very interesting that Hugh very astutely pointed out is it does not waive the completion of the care plan, except in instances of COVID-19 for transfer and discharge. So while the MDS time frame may have waivers attached to it, there are no waivers related to care planning. And care planning, especially the initial and the comprehensive, are predicated upon by the completion of the MDS. It does not apply to 641 for accuracy of assessments or 642 for coordination and certification of assessments. Jill, did you have any thoughts on that?
No, this is exactly what I read.
Hugh, anything for addition?
No, I think that one is fairly clear. It's just to be sure that the care plan is completed. While you don't have to transmit the completed MDS, it doesn't waive the fact that you've got to have that care plan in order to provide the care for the resident, except under the transfer and discharges, and we'll be looking at that one as a part of one of the waivers on into the session.
Yeah. And interestingly, in the waiver itself, it does not give you an acceptable time frame. It doesn't give you a window in which you can submit and still be considered to be in compliance. It's very open-ended. So again, that's going to mean it's open to interpretation
Right.
unless additional clarification comes down the line, as they come down the line nearly daily. Pat, did you have anything to add for this?
I did. I think one thing to remember, it's extremely remember, is that the conditions of participation in Medicare have not changed. So while CMS is saying that they are not, they are waiving the submission timeframes, the rule that you must submit and have accepted the PPS assessments before you bill has not changed. So remember that even though it's acceptable not to get them submitted in a timely fashion, you can't bill Medicare until those have been accepted by CMS. So I think that's another extremely important criteria to remember.
Yeah, thank you so much. So there were waivers related to the PASARR completion. It is allow nursing to admit new residents who have not had a level 1 or level 2 pre-admission screening, and specifically the regulation for that is FTAG 645. It does not waive the completion of the PASARR. It simply allows you to delay the timing. Again, as we stated before, only waives the timeline for its completion. The level 1 may be performed post-admission as opposed to pre-admission. And level 2 should be scheduled on or before the 30th day of admission. This one at least is giving a time frame. It's basically saying you have 30 days, within 30 days of admission to complete this. We're not so lucky in some of the other areas for it to delineate that quite so clearly. The waiver does not apply to F644 for coordination of assessments or F646 for MDID significant change notification. This one felt relatively straightforward. I don't know, Hugh, if you had any additional information to add for this.
I do not.
Jill, Pat?
Well, this is Jill. I would actually suggest to check with your state. I read one in regards to, like, for example, Texas, where certain requires were waived, i.e. the PL1 that is positive, the PASARR level 1, going to the local authority first. But it now appears it can go directly to the facility and then it can be contacted. So again, some of these, even though it's coming out like this, I strongly would suggest to check with your state to find out if there's any specifics that are related to your state that needs to be followed.
That's an excellent point. Thank you so much, Jill. And something we probably didn't say at the beginning was, you know, we're addressing the federal waivers and how it correlates to the federal FTAGs, but there are state waivers in place as well. Generally, the guideline is whoever has the more restrictive regulation is the one that you adhere to. So there may be much more detailed and descriptive state tags that are not waived in response to some of this as well that are still on the table for compliance. We're specifically sticking to the federal waivers and the federal guidelines. Pat, did you have anything additional for the PASARR?
No, thank you. You actually hit on it when I referencing that they need to be looking at the state waivers as well.
Awesome, thank you. Resident groups. This one was very interesting when you started to dig into it. The waiving of the requirements for residents to participate is specific to in-person resident groups. And the wording is quite specific in the waiver that it is in-person resident groups. This specifically applies to F565. And as you may be aware, this is a substandard quality of care tag depending on the scope and severity for the tag where the citation would fall. It does not remove the right to participate in family or resident groups. The key words or the focused words are in person. It only waives in-person meeting requirement due to the public health emergency. The other thing to remember is the waiver does not affect the remaining resident group requirements as they relate to providing assistance view grievances, participate, and have family representatives present. The methodology in which that gets accomplished may have to change and will obviously have to change and be flexible, but the only waiver there is really the in-person. Hugh, you really focused in on this when you were doing through, and it was sort of eye-opening because I didn't anticipate that at all in the clarification.
That's correct. When I looked at it and began to the key word, as you pointed out, is in person. If that resident group can meet via teleconference, GoToMeeting, Skype, some other method rather than in person, they can still do that. It only restricts to in person, doesn't restrict the meeting. So, and even in the waiver, it talked about social distancing and limiting gatherings of more than 10 people. Some of the things that we looked at was, if my facility does not have COVID-19, does this waiver apply? And we don't have the answer to that. That was just one of the questions that we looked at. How does this apply? Can I still have in-person meetings if my residents do not have signs or symptoms of COVID-19? There are none in my facility. Does this waiver apply? So I think you would have to ask your state agency on how they interpret that. But the waiver specifically just speaks to in person.
That was something that, again, you read the verbiage in the waiver, but it doesn't really click until you start to look through the rest of the requirements in the tag and realize it's only the in-person aspect of it. Jill, did you have any thoughts in regard?
No, this is a tricky one too, but no, I agree. I agree with what Hugh said in stressing that.
Yeah. Pat?
No, I think you've said it pretty clearly, and I think anything else we might just make it muddied, but.
And if anybody, again, as we said at the beginning, has any experience with dealing with this, maybe through a complaint or through family complaints or concerns or resident concerns, and you sought clarification either through CMS or your state agency, we'd love to hear what the guidance was, anything that could potentially help anyone else on the call. One of the other waivers specifically applies to resident roommates and grouping. And this is sort of one that, again, when you got into the details of the regulations surrounding it, had some interesting points to it. So CMS is waiving the requirement, and again, solely for the purposes, is emphasized in the waiver, of grouping or cohorting residents with respiratory illness symptoms, or if you have a confirmed diagnosis of COVID-19, and separating from residents who are asymptomatic or have tested negative. So this is the 559, and again, this carries a substandard quality of care tag to it as well. And again, they further clarify that the action waives the facility's requirements to provide for a resident to share a room with their roommate of choice in certain circumstances. The provision of notice and rationale for changing a resident's room, providing for a resident's refusal to transfer another room in a facility, this portion is waived. And again, that's at tag 560. So we're covering more than one tag with this individual waiver. Ironically, when you go into the tag, as Hugh did, the waiver did not include the provision for married couples sharing a room, which raises questions, which again, puts you into the situation. Hugh, did you want to speak to that as well regarding where the concerns may be?
Yeah, it was when we evaluated the rule, we noticed that it eliminated, it failed to include E4, which is still part of the tag of 559. And what we read into that was, if I'm a married couple and if I get COVID-19 and my wife doesn't, according to this waiver, then you can't separate the couple if they choose not to be separated, because it's not a part of the waiver, and the state may have a different take on that, but it's omitted from that, and when that caught our attention is for that particular waiver.
we were kind of like working our way through this because, again, there's some substandard quality of care risk associated with this. But if you have a married couple sharing a room with that exact situation that he was outlined, and you, for health and safety reasons, elect to move them out against their wishes, you can have an irate resident or two irate residents. You can have family members upset regarding that. It could lead to a complaint to the Department of Health. And the thing to remember is substandard quality of care obviously, only applies in certain instances, but harm level tags and citations coming from that do not have to have physical harm. I have received in my career G-level citations related to psychological harm as interpreted by a surveyor.
I think a couple of other things that I looked at evaluating this is this particular waiver only applies to an advance notice. You still must apply the notice. You don't have to give them an advance notice for a roommate change or to change a room, or an advance notice where they can refuse that transfer, except for E4. My other thought was, if I am a facility that doesn't have COVID-19 residents, does this waiver apply to me? Because if you go back and look at the slide, it says the waiver solely for the purposes of. So that's the only way, that you can't just go in and move a resident and use this waiver unless they meet this criteria. Because the second bullet point talks about certain circumstances, which applies, which is explaining the point number one. So here again, others may have had some experiences with this, and any information they can share on that would be certainly help us provide the better information. But that was just some of the things that caught my attention as I went through that.
Yeah. So, again, it just raises a great point, is in looking at this, as we say, there's sort of the spirit of the waiver, and then there's the letter of the waiver. This very clearly points out this waiver is specific to the COVID-19 and the public health emergency. It's a great point to say you can't universally apply this to everybody and use this as an opportunity to move residents around if it is not being impacted by COVID-19.
Yeah, the key point on that too, Greg, is it only is talking about the advance notice. You still need to inform the resident and the family why you're moving them. It's just eliminating the advance notice.
Yeah, excellent point. Pat, had you thoughts for this?
No, thank you. That was actually the statement that I was going to remind everybody. It's really more about the elimination of that advance notification. So
wonderful, thank you. Jill, anything?
No, well stated, everyone.
We're all leaning on each other through this because this has been such a heavy lift to go through all this information. Thanks to the team that's on together. Clinical records. The waiver in relationship to clinical records basically seem fairly straightforward. They are modifying the requirement for long-term care facilities to provide a copy of the records within 2 working days in the event it's requested by the resident or the responsible party, actually. FTAG 573, the specific tag that this relates to, but it only applies to the time frame requirements for providing copies of the records. So in the regulatory requirement, it lists 2 days. They're now giving you 10. So again, in this instance, they do provide a time frame which is still going to be considered acceptable. And if you exceed the 10 days, you would be out of compliance even with the waiver. And remember that the waiver doesn't affect the requirements providing access to records within 24 hours, or it doesn't affect the format and manner in which records are provided to the resident. And remember, if it's an electronic record and they choose to receive it electronically, you have to provide the information in the same manner in which it was originally created. So there's still stipulations in the clinical records surrounding this. Really clearly, the only thing is going from 2 days to 10 days to provide the information if and when it's requested. Hugh, did you have any additional information for that one?
Yeah, the time frame is for work days, not calendar days.
Great point. Great point. Jill or Pat?
Not I.
No, nothing else to add. Thank you.
We get deeper into some of these are going to be a little bit more involved. There's more slides associated with it and probably a lot of opportunity for discussion as well. For your QAPI program, CMS modifying certain requirements, which requires long-term care facilities to develop, implement, evaluate, and maintain the effective, comprehensive, data-driven QAPI program. It's certain requirements, specifically under FTAG 865, 66, and 67. To the extent necessary, they're modifying the requirements to narrow the scope of your QAPI program to focus on adverse events and infection control. They're not waiving QAPI. They're allowing you to narrow the focus of and the scope of your QAPI program to focus on what's happening now with the pandemic. It doesn't eliminate QAPI program requirements. It only moves the focus to adverse events and infection control. Does not affect the requirements for maintaining a QA&A committee at FTAG 868. So again, if this is something that, you heard the blanket waiver, the QAPI program is waived and you haven't held a meeting or you've had no, and I'm sure most people have, I'm sure there's tons of ad hoc meetings going on, but if you've marched through a quarter without holding a formal QAPI program, you may be at risk for non-compliance. Pat, what were your thoughts for this?
I think the only other thing I would make sure and add is to know that when they are looking at these, they are going to make sure that your QAPI program does have information on your adverse events and infection control. So it's not just enough to have the meeting, the QAPI meeting. They are really looking to ensure that you've included those two components to that meeting.
Hugh, did you have any thoughts?
Yes, and to add on what Pat was talking about, the waiver does not eliminate the QAPI program for other actions. For example, if during the infection control research you identify a particular problem, let's say staffing issue, that may have been the root cause of the infection control, your QAPI program still has to determine, has to meet according to that. So it's not eliminating other parts of the QAPI program at these tag numbers. You still have to do that, but you just need to focus on the adverse events and infection control. But keeping in mind, if you find something else, your QAPI program still has to investigate that.
Excellent point. Jill, any thoughts?
No, I think everybody made the great points on that and stressed key areas.
All right, moving into the next one. This one's where we're going to probably dig a little deeper into some of this because there are a lot of unanswered questions in relation to this, as well as transfers and discharging. The nurse aide in-service training. So CMS is modifying the training requirements for SNFs and nursing facilities in regards to nursing assistants receiving at least 12 hours of in-service training annually. This is FTAG 947, which applies to the training, but this is the annual 12 hours of training. It does not eliminate the requirement to provide the in-service training. It extends the 12-hour annual requirement until the end of the first full quarter after the public health emergency concludes. So again, if you've got a program that points to, every month you're completing 1 hour of training, you can extend that to the end of the first full quarter, but you can't not do it. You can't just ignore the training requirements for the 12-hour period. It must still be provided, especially when competency issues are identified and upon new employment of nurse aides. It does not affect the requirements which pertain to dementia, abuse prevention training, performance reviews, and the care of the cognitively impaired. Hugh, what were your thoughts on this?
This one's pretty straightforward. It's the next one that I think that we're going to get bogged down.
I think this one, again, the only concern that we keep hearing or having from these is that term blanket waivers, and when people believe this is basically giving you a free pass on this training, that's not the case when you look at the verbiage. This next one is definitely the training and certification of nurse aides. So we had several lively discussions on this just this morning as we were going through the slide deck, They're waiving the requirements which require that a SNF in a nursing facility may not employ anyone in excess of 4 months unless they meet the training and certification requirements. So the waiver is applying to the 4-month limit before someone would need to pass certification test. This covers FTAG 728, 729, and 730. Within this waiver, they are not waiving the facility's responsibility not to use an individual working for more than 4 months unless the individual is competent to provide nursing and nursing-related services. So competency does not get waived. The ability to have not sat for your test, many training sites and testing sites aren't open right now. You can exceed the 4 months. Again, there's no time frame for how long. It just kind of depends on the public health emergency and what they're going through. But you still have to ensure the competency of the individuals that are working to provide the nursing and nursing-related services. They also note they are not waiving the facility's requirement to ensure that nurse aides are able to demonstrate the competency and skills and techniques necessary to care for residents' needs, as identified through resident assessment and described in the plan of care. This just raises so many different questions regarding what is going to be allowed or what isn't allowed. Hugh, I know we were discussing this sort of back and forth this morning as well.
Yeah, some of the waivers, some of the state waivers that I've looked at address in-state and out-of-state. If I have a nurse aide in-state who has not completed the training requirement, I can still use them if they have not completed the program and they are competent to perform the nursing services. Some states that I've looked at permit me to use out of state if they have not been certified, if they've gone through the program. Some of the things that we looked at this morning is, can I employ an individual who is not enrolled in a nurse aide training program based on this particular waiver? And I think here again, we have the facilities need to be sure that they're looking at their state waiver as well.
Right. Yeah, and even we were discussing those employees that may not have received the 16 hours of training that is required before you go out and interact with residents. That's not addressed in the waiver.
It is not addressed. The orientation, 16-hour orientation program is not in the waiver. They added a new one this morning, and we'll get to that at the end. But it doesn't say that it's waived. It doesn't say that it isn't. Another issue that's not addressed is the nurse aide registry check. So if I'm waiving that requirement, am I also waiving my checking the nurse aide registry? And there's nothing in there that talks about exempting a background check. For example, when you look at tag 606, which is an abuse tag, which that tag deals with not employing or engaging staff with adverse actions. So it's so unclear what all this involves. There's more to it than just that particular waiver. All it's doing is waiving the fact that they do not have to have completed the training program, but it left so many other questions unanswered.
I think, as a general rule of thumb, a good guidance would be, if it's not addressed in the waiver, it's probably not waived, but when in doubt, call your state agency. Again, we're going to run the risk of having this become an issue in subsequent surveys, and once we're past this and the survey process resumes, it's somewhat of human nature to do a lot of Monday morning quarterbacking on the decisions that were made in the midst of a crisis. Again, if your state agency is the one that's coming in to survey you and you've sought that clarification, you've recorded that in your QAPI, either ad hoc minutes or in some way, shape, or form, you've documented that conversation and instruction you received, it's the simplest and easiest way to protect yourself, as opposed to running the risk of misinterpreting the waiver and going down a road that may lead to consequences.
I think one of the things that you pointed out earlier, and this is a good example, when you look at the second bullet point, it applies to 728, but not all of 728, because it exempted D1I, which is tag number 728, but it didn't exempt D12. So one of the things that we, as you stated at the beginning, is not all components of a tag number is incorporated in the waiver. And that's when we went through this, that's what we began to see, that not all the parts of the tag number are waived.
And the document that you created that we're sharing is one of the handouts, and that you'll do the walkthrough at the end much more clearly puts this information. We're trying to do a broad 10,000-foot view overview of the information, but don't be daunted by the 188 pages. It is linked. It's a great, wonderful, amazing tool to be able to navigate your way through this. Well, there we go. Resident transfers and discharges. And again, this is another area in which there is a specific focus on COVID-19. It's waiving the requirements with some exceptions to allow the facility to transfer or discharge a resident to another long-term facility. And again, the term solely for the following cohorting purposes. Now, again, this is directly linked. This waiver applies only in the instance that you're transferring a resident with symptoms of respiratory infection or a confirmed diagnosis to another facility that has agreed to accept each specific resident and is dedicated to the care of such residents. Or you're transferring a resident without symptoms of a respiratory infection or confirmed not to have COVID-19 to a facility, again, that agrees to accept the specific resident and is dedicated to the care of such residents, preventing them from acquiring COVID. And of course, the third is transferring residents without symptoms to a facility, again, that agrees, and they very much highlight the agreement to accept each specific resident to observe for signs and symptoms of respiratory infection over the course of 14 days. This one has a lot of moving parts to it. And I believe we've got a number of slides, that are sort of addressing the exceptions to this. So just on that face value, Pat, I mean, you were elbow deep into the transfer and discharge requirements for this one as well. Is there anything that you felt needed additional clarification?
Not on this one in particular, but when we get into the slide, I believe you have about transferring residents and whether the billing part of it, that's probably where I would have a couple of comments I want to make.
Yeah, the exceptions as we go down further into the exceptions.
I think this is fairly clear. I mean, the language, again, solely for the following cohorting purposes, they spell out the agreement, but then there's the exceptions. So the exceptions.
Greg, what those references deal with are the advance notices and what's in the notice. So that's what those tag numbers deal with. And they're addressed a little bit further down, but that's what this is dealing with. Notices, the notice, what's in the notice, the time frames, and that's what they're waiving only for those three specific instances.
Thank you so much. Well, again, and then the exceptions that apply to this, because it's not blanket. The requirements are only waived where the transferring facility receives confirmation that the receiving facility agrees to accept the resident to be transferred or discharged. The confirmation can be in writing or verbal, but if it's verbal, the transferring facility definitely needs to document date, time, person the receiving facility communicated the agreement to. Oh, pardon me. CMS is only waiving the requirement that a facility provide advance notification of options relating to transfer, just as you said moments ago. Otherwise, all the requirements, the remaining requirements, are not waived under FTAG 552. Similarly, only waiving under 43.15, which is 623 and 625, the written notice of transfer or discharge to be provided before the transfer or discharge. However, just as I think you pointed out earlier, the notice must be provided as soon as it's practical. Hugh, did you want to comment or provide?
No, that I have not.
Fairly straightforward, I believe. Again, written or verbal understanding the agreement and documenting that agreement if it's verbal. Additionally, only waiving timeframes for certain care planning requirements. This was sort of tied into what we were talking about in the MDS as well, but for residents who are transferred or discharged for the purposes explained, remember in 1, 2, and 3, went to the active, confirmed, suspected, or exposure basically without symptoms, they were for under observation. In the absence of that, the receiving facility has to complete the required care plan as soon as is practicable. This is the only care planning section, I believe, that is addressed in any of the waivers. They expect the receiving facility to review and use the care plan from the transferring facility and adjust as necessary to protect the health and safety of the residents in which it applies to. The requirements are also waived when transferring to another facility, such as the COVID isolation and treatment location, where the provisions of services under arrangement, as long as it is not inconsistent with the state's emergency preparedness or pandemic plan or is directed by the local or state health department. So even though they're federal waivers, there are still references back to your state requirements, state emergency preparedness, state, even regulations. We'll get into practice acts and scope of practice as well in some of the later ones. Hugh, did you need to add any additional comment?
I do not.
Pat, Jill?
Do not.
No.
The next one is a little confusing in some cases. In cases where the transferring facility, the long-term care facility does not need to issue a formal discharge, as it is still considered the provider and should bill Medicare normally for each day of care. The facility is then responsible for reimbursing the other provider that accepts its residents during the emergency period. That's sort of, well, I'm going to put both of them up here so we can discuss both at the same time. If the transferring facility does not intend to provide services under the arrangement, and we'll talk about situations in which these two criteria would apply, the isolation and treatment facility is the responsible entity for Medicare billing purposes. So should follow the procedures described for Medicare claims processing to submit a discharge bill to Medicare, and the COVID-19 isolation and treatment facility should then bill Medicare appropriately for the type of care provided for the beneficiary. So what are the two instances that we feel these are applying to? And Pat, we've had some experience recently with helping out one of our clients in setting something like this up.
Exactly. What this particular organization did is they had another facility that had a floor that they were able to empty out. That facility was actually not a Medicare certified facility, but through the state, they were able to get a waiver from that state to take one wing of that non-Medicare Medicaid certified building and just connect it to the parent facility. And so they just added, quote, a wing, and that's actually up in the top. So basically that resident was still considered to be part of that facility, and for all intents and purposes, care owned and issues owned by that facility. And then they just paid, quote, rent to the other facility for that space. So in that instant, that resident, everything continued on. Medicare continued on, the MDSs continued on because they were part of that building. In some other instances where you are actually transferring a resident to another location, and then you would be discharging, don't forget the same process of doing your advance notification. You do your discharge bill. The facility that is receiving that resident will then start with, as a brand new resident, entry, Medicare part, a 5-day PPS, et cetera, and the admission assessment. So the difference is which one is going to be responsible for that resident and who's going to be doing the bill. Okay. I hope that clarifies it.
Yeah. Hugh?
No, I don't have anything. Thank you.
And I think, and Jill, I'm sorry, I don't mean to exclude you. Any additional thoughts?
No, that's exactly what I was hoping Pat stressed, and she did. Thank you.
And then it's still tying into this. Again, we're still under exceptions to the resident transfer and discharges. There's the possibility, and in the instance of the description that Pat was talking about, the facility that was basically renting out space did not have a Medicare number. So if the COVID isolation and treatment facility is not yet enrolled provider, you have to enroll through the provider enrollment hotline for, contact your MAC, your Medicare administrative contractor that services that location to establish temporary Medicare billing privileges. We really are pushing in this as well. The CMS has reminded long-term care facilities, you are responsible for ensuring that any transfers, either within or to another, are conducted in a safe and orderly manner, and each resident's health and safety is protected. Nothing excludes from that. But we've heard it on the CMS open forum calls that, some facilities that do not have a provider number wanted to start taking the Medicare patients, especially in hotspots, to provide relief for hospitals. You have to have a provider number to be able to bill. And in all instances, CMS kept directing them back to their state agency. You had to coordinate this through and contact your state agency to get this set up. CMS was not really providing any additional feedback beyond that. Hugh, did you have any other experience with that?
No, sir.
Pat?
No, that clears up what I think was the additional piece.
Yeah. Okay, great. Discharge planning, another portion of the waiver. CMS is waiving the discharge planning requirement, which requires facilities to assist residents and their representatives in selecting a post-acute care provider using standardized patient assessment data, quality measures, and resource use. This is FTAG 660, specific to that. The waiver only applies to providing MDS quality measure and resource use data to the resident. All of the discharge planning requirements remain. They're maintaining all of the discharge planning requirements. It does not affect the discharge planning requirements for the discharge summary either at F661. I know, Pat, you have been elbow deep in discharge planning. I think I've said it before. Your thoughts?
Yeah, I think the important thing to remember is that the discharge plan and with this, the most recent phases of the survey process, where the facility is required to provide quality measure data and resource data for that resident and a family member where they're going. For example, if they were going to another skilled nursing facility or they were going to home care. And that's part that has been waived. So what they're trying to do is waive the requirement to take the time to research that data to provide to the family. But all of the other requirements for discharge planning still remain and will be looked at. And Hugh, I didn't know if you had any other comments on that one, because I know this was something you were really close.
No, you clarified that really well, Pat.
Jill, any thoughts?
I agree with Hugh on how Pat clarified that. That's good.
I know we're running over here, and I apologize. We're just trying to be comprehensive with it as well. The waiver for physician visits as well, and I'll move a little bit quickly because I want to make sure Hugh has the opportunity to show that tool and how the best utilization of that is. So the big requirement, the waiver here under physician visits, is that the physician visit be made by the physician personally. It's made modifications to permit physicians to delegate required physician visits to a nurse practitioner, a PA, or a clin nurse specialist who is not an employee of the facility, but it has a collaborative agreement with the physician and is licensed by the state and performing within the state's scope of practice laws. Scope of practice laws vary between states, sometimes drastically, and again, the federal waiver is not trying to waive those types of requirements. This is F712 and F714 for the physician visits. Again, the modification is only about that the visit is made personally by the physician. It's not waiving the frequency of visit requirements. So, or the physician's supervision requirements or the availability of emergency physician care. 712, 710, 713 are not affected by the waiver. The delegation of tasks in the skilled nursing facility, again, they are waiving the requirement that prevents a physician from delegating a task when the regulations specify the physician must perform it personally. Again, FTAG 714 as well. Again, this focuses on the ability to delegate any task to a PA, an NP, or a CNP or CNS who meets the applicable definition. And again, it's licensed by the state, acting within the scope of practice laws as defined by the state. The federal can't waive the state scope of practice laws that are governing that. CMS is temporarily modifying to specify that any task delegated under this waiver must continue to be under the supervision of the physician. Again, 714 tag, the supervision is not wavered. and does not include the provision that prohibits a physician from delegating a task when the delegation is prohibited under state law. So they don't get to color outside of the lines as far as the practice act or the state law goes and delegate responsibility that is in excess or violates that law. Hugh, you had some thoughts for this.
Yes, the only thing that I would add to that, and we failed to put it on the slide, it is in the handout. The personal visits can be made by telehealth. What the waiver does is it waives who can provide the service. It doesn't waive the service at all. So it doesn't mean if whatever that resident needs, whether it's provided by the physician or someone that physician has delegated, the service still has to be provided, but it can also be done by telehealth.
Excellent, thank you. Physical environment, the waiver specific to the following, again, it doesn't cover everything, but requires facilities and equipment to be maintained for an acceptable level of safety and quality, is temporarily modifying those requirements to the extent necessary to permit these facilities to adjust scheduled inspections, testing, and maintenance. Inspection, testing, and maintenance, frequencies and activities for facility and medical equipment. Temporarily modifying the provisions to the extent necessary to permit facilities to adjust the inspection, testing, and maintenance frequencies by life safety and the healthcare facilities code. I think that one, what they do basically under is what's not included. This is more specific to what's not included. That seemed relatively straightforward, but if it's considered critical, it's not included. Your sprinkler system, KTAG 353, portable fire extinguisher, monthly inspection, elevators with firefighters, emergency operations, the monthly testing, emergency generator testing for 30 continuous minutes. None of this is waived. And the means of egress, the daily inspection in areas that have undergone construction, repair, alterations, or addition to ensure the ability to be used instantly in case of emergency. Hugh, did you have any additional thoughts to share with that?
I do not.
Then, of course, the other ones are the facility does, the requirement to have an outside window or outside door in every sleeping room is waived. It will permit a waiver of the outside window and outside door requirements to permit the ability to use non-facility space not normally designated for patient care to be utilized on a temporary basis for care or quarantine. But you have to remember, it does not eliminate the scheduled maintenance program. It only permits the facility to temporarily modify the inspection, testing, and maintenance for non-critical items and to permit the use of rooms that don't have an outside window or outside door. Now, I know we went through a lot of that quickly. Jill, Pat, Hugh, anything you'd like to add on some of the last talking points?
No, not me.
No, thank you. I think you've covered all that.
Wonderful. I really want to give Hugh the opportunity to start work to show his tool at this point. Dahlia, could you give?
Well, I think you've got one other. You've got one that was added today.
Oh, I'm so sorry. Yeah, thank you. The paid feeding assistance, that's right. And again, this herding cats thing where things come almost hourly. There's the most recent one for the paid feeding assistance that literally just came out right before we were doing our final preparation. They're modifying the requirements regarding training of paid feeding assistance. So specifically the minimum time frame requirement in that section that requires the training to be a minimum of 8 hours is allowing the training to be a minimum of 1 hour in length. It's not waiving any of the requirements related to paid feeding assistance or the required training content, which contains infection control and other elements as well, and is not waiving or modifying the requirement which requires that a feeding assistant must work under the supervision of a registered nurse or licensed practitioner. So that's hot off the presses, from as early as this morning. And again, it does not include requirements at F811. Hugh, did you want to add any specific clarification?
No, because that one just came out this morning.
We added it in.
We've not had really an opportunity, but the only thing that I can see that is waiving is from the 8 hour to 1 hour.
And again, it's to shore up the potential staffing shortages that may be existing.
Yes.
I need to go to.
If Dahlia will give me the screen, I will show them how to
I believe I
The
handed it
handout,
over.
yeah, this handout is extremely, are you able to see that, Greg?
I am, yes.
All right. The handout that you have, all of the information that Greg has gone through is provided in this handout. For example, and we provided you with the discussion points that we addressed among ourselves, and we thought we would just leave those for you to look at. But the good thing about this tool is it's linked. So if I'm looking and I want to look at the requirements for payroll-based journal, then I can immediately just advance to that tag. So every area that we have discussed is provided in the handout with all of the regulations. So all I need to do is just click on that, and it will take me directly to the regulations. So you don't have to sort through and find all of the different regulations. Everything that Greg has discussed, we use the information and the description of the waiver. And this information came directly from the CMS waiver document. We just put it in this format and tracked what are the affected CFR reference numbers. Not every part of that reference number is included. Down here we provide information of what's not included and things that you may want, and you may have other things that you want to look at for discussion points. But we wanted you to have this kind of crosswalk so that you could use that information. In fact, we added about 30 minutes before the session, we added this last slide or information on paid feeding assistance. And here again, it's linked on what the requirements are. It addresses in the data 43160. Well, 43160 deals with the nurse aide training program, but the last paragraph of that dealt with the training of paid feeding assistants. So every one of the waivers that have been discussed today are here. And I think you will find this extremely useful. It's very easy to use, and you're going to like the linking feature. So that's all I have on that. And if you can't download that, be sure and let the support know that, and we'll make sure that you can get access to this. One of the things that CMS did release today was some additional physical environment, and it addresses pretty much so what Pat was talking about in adding the facilities, what the facility can do and how to do that. And they added that today. So that's all I have on that. I hope you. I know we did a lot, but I hope you found it helpful and give you an opportunity a roadmap to look at what the survey tag numbers and how they are impacted.
And I think that tool, it's such an amazing tool to be able to, if you have a question regarding a specific waiver, the waiver is listed on the left. You can link right to the tag. You don't have to read all 180 or 127 pages. Oh, so sorry. You don't have to read all 127 pages. You can simply sort your way through to get where you need to find the answer. Pat or Jill, any last comments?
No, this is good, I think. Thank you very much. It's good.
And I do think there was one other question. This is Pat and Jill. You might be able to help them because this is an MDS coding. And I think we've heard this being asked a lot, and I know you've been staying up on some of the clarifications. The question, are long-term care facilities able to code for isolation precautions related to COVID in the MDS? New admits that are isolated for 14 days on admission, which is the incubation period for the virus.
No, the criteria for coding isolation did not change. You still must meet all 4 criteria, and it's very specific in regards to coding isolation. So just as a preventative, as a monitoring, but no confirmed active diagnosis, then you cannot code isolation. You must still meet all criteria.
In the private room, I think, is the biggest difficulty there, being in a private room.
Yeah, cohorting doesn't count. It all must be private in the room alone.
Right. And to what Jill, I think what you said, that they've got to have the active precautions, an active cough, that type of thing, because just isolating them because you're monitoring them is really not the criteria. So we always refer you back to the actual MDS coding, and I know that's been a couple questions. So I hope that has answered your question. I know it's probably not what everybody wants to hear, but CMS has been pretty strong about maintaining the criteria for isolation when you're coding the MDS. Totally different from what they're recommending in all of their COVID information. The MDS stayed the same.
Thank you all so much for hanging in. I apologize for going over as far as we did. We knew this was quite a bit chunk of data to go over with everybody and try to provide the information. So thank you so much for your time. Dahlia, anything for closing?
No, thank you so much. This is a really just exciting information that each of you are pulling out and making it so easy to understand. It looks like we've answered all of our questions. And again, if anyone needs anything else, please reach out to support@teamtsi.com. You'll also receive a follow-up link in your email from GoToWebinar, and in that link will give you one more way to get to the recording and also to the handouts. So thank you all so much. This was wonderful. That concludes our webinar. Thank you, everyone.
Thank you.
Thank you,
Bye-bye.
everyone.